I'm Dr. David Little and I practice in San Antonio, Texas. I have an interdisciplinary, multi-specialty office that focuses on implants and restorative dentistry. I think what we do is a gift. I'm very passionate about dentistry, and putting implants into edentulous patients changes their lives. And so if we can allow them the ability to eat what they want instead of eat what they can, that's my goal. And we do that today with technology, and by using CBCT, planning software, intraoral digital impressions, surgical guides, we can really make a difference and see the end before we start. My expert tip today is on treating the edentulous population and soon to be edentulous population. And really what I want to talk about is solutions to help get the results that you want to get. Specifically today I'm going to talk about an abutment from Zest that's called FTX. It's a fixed solution that has no screws, no cements. It can decrease the time, so that, decrease chair time, which really makes a difference. And also it can help the integrity of the prosthesis. So one specific solution is, what about if you have a case that's an all on X and you lose one implant? Well, normally you'd have to replace the implant and then make a completely new prosthesis. Well, with this system and with the abutment, we can go ahead and place a new implant, and because the abutment can rotate 360 degrees and it doesn't require screw access, we can retrofit the existing prosthesis. And so now what you have is a combination case where you have multi-units and FTX. And so that combination really works well, and so I've actually used it a lot of times now when I have a case where I need 30-degree angles. I'll use multi-unit abutments, and then I'll use the FTX in the anterior. And what that does, it saves time. It also, you don't drill holes through your aesthetic areas, and also makes the prosthesis stronger. So it can be a really good solution for these kind of cases. Now in our practice, we do a lot of full arch implant dentistry, and normally I have a technician that comes to the office and does the retrofit for us. So by the time when I pick up the prosthesis and hand it to the technician, it normally takes them with a full multi-unit about an hour and a half. Now using the FTX or the combination case, it cuts that time down to 30 minutes. And so that's a really good time savings. And again, also it keeps that prosthesis from having holes in it, and increases the integrity of that restoration. So one of the important issues with these restorations is being able for the patient to maintain it, and secondly, to bring them in regularly for hygiene visits. And I bring them in every 3 months, and then every year we remove the restoration. And that can be time consuming, having to drill out the temporary, take out the Teflon tape, take the screws off, and then replace the screws and put them back. With this FTX system, and even in a combination case, with those FTX, you literally can change those attachments outside the mouth. So it makes it much more efficient, much easier for the patient, and to coordinate with hygiene, it just makes a big difference. So, this system can, increase efficiency by, limiting chair time, and also you're not drilling holes through the prosthesis, so you're not messing with the integrity of the restoration. And this can be used on any type of restoration: acrylic, titanium with acrylic, zirconia, and they all work well with this system. So it's something to take a look at. And again, I love doing these cases because it literally is life-changing. So if I can help with any of the questions about this solution, please feel free to reach out to me. Thank you very much.